The number of intensive care beds in Scotland should be doubled to help the NHS cope with a surge in critically ill coronavirus patients, the Health Secretary has said. Jeane Freeman said there are also plans to train non-intensive care staff to take on extra duties as demand increases, and warned that the infection is likely to claim many lives. It comes as the Chancellor prepares to unveil a multi-billion package today to help businesses manage the coronavirus crisis, with England's Deputy Chief Medical Officer Dr Jenny Harries warning that the UK's peak epidemic stage will begin in around 2 weeks' time when many thousands will be infected. The number of confirmed cases in Scotland of COVID-19, the disease caused by the virus, has reached 27, with a 6th death now recorded in the UK. The man, who was in his 80s and had underlying health conditions, died on Monday night in Watford General Hospital in Hertfordshire. He had picked up the infection within the UK. To date, 373 people in the UK have tested positive for the virus. Briefing MSPs in the Scottish Parliament, Ms Freeman said increasing intensive care capacity and flattening the peak in coronavirus cases so that they were spread out over a longer period would be vital to easing pressure on the NHS. She said, "Part of the work we're undertaking is in terms of looking at bed capacity across the whole estate and doubling our intensive care beds, and ensuring we have the right trained staff and the right equipment in order to be able to do that. We will continue to look at what more can we do to maximise our capacity to respond to this. At the same time, we're taking the action to flatten that peak so that we give ourselves the best possible chance to do so. All of us need to understand that the situation is a serious one. That whilst many people will be mildly affected, for some this will be a serious infection, and for many people it will potentially cause their death." According to the most recent audit, NHS Scotland currently has a maximum of 275 intensive care beds with occupancy running at around 84%. An estimated 5% of patients who develop COVID-19 become critically ill with complications such as pneumonia, sepsis and organ failure, which will require ventilation to keep them alive. Ms Freeman said the extra beds would be staffed by training skilled NHS staff from other departments to take on new roles within intensive care, leaving our highly skilled intensive care staff to do only the things that they are qualified to do. She added, "What that means in practical terms is that, as far as it is possible within the bounds of patient safety and good clinical care, the model for intensive care will have to shift a bit in order to allow us to cope with more people in intensive care beds with the maximum clinical input and maxi." For more on this story, visit the news article link.